Okay, welcome back everybody for part 2 of our lecture on the endocrine system. And so in this portion, we want to look at how we control the release of hormones. And most of the release of hormones is controlled through the pituitary gland. Okay, so just recall that the pituitary gland is a little gland that hangs just below your brain. Here's the brain, here's the sphenoid bone. And so it hangs in just that little pocket in the sphenoid bone. And then it also has a connection to the hypothalamus. And the hypothalamus is important as well because while the pituitary gland sends out hormones that will stimulate other glands to release their hormones, the pituitary gland is actually getting its orders from the from the hypothalamus. Okay, so notice I have here hypophysis in parentheses. That's the other name for the pituitary gland. Okay, so the pituitary gland is also known as the hypophysis. So just make sure you don't confuse that term with hypothalamus. Okay, the hypothalamus is another region in the brain, and we've spoken about it already. So here you can see it's in the diencephalon area. It's this area shaded green here. This portion is the hypothalamus. Here's the close-up of it. And so it's got connections to the pituitary gland. Okay, and that connection is through this piece of tissue here called the infundibulum. Okay, so I'll come back to that in just a minute. Because back to the pituitary gland, the pituitary gland itself also has two different areas. They're anatomically different from one another because of the tissues that they're made out of, and they're functionally distinct from one another as well. So the portion on the back side of the pituitary gland is called the posterior pituitary, also known as the neurohypophysis, right? Because it's made out of nerve tissue. So that's back here. The front part of the pituitary gland is the anterior pituitary, right? Anterior means front. And that one's called the adenohypophysis. And because that's made out of epithelial tissue, and it's the epithelial tissue inside of here that can make other hormones. So what we're going to see in a moment is that the pituitary doesn't make its own hormones. It actually receives hormones from the hypothalamus. The anterior pituitary does make its own hormones, but it gets orders to release those hormones from the hypothalamus. And again, the connection between the anterior pituitary and the posterior pituitary to the hypothalamus is through the stalk, which is called the infundibulum. Okay, so let's look at the posterior pituitary first. You know what, let me come back to the slide and let me show you this one. So you see the relationship first, and that's going to make the other slide make a lot more sense. So remember that the hypothalamus is part of the brain. And so therefore it has neurons. It's just made of several neurons. And so there are clusters of neurons that are associated with the posterior pituitary gland. And those clusters of neurons, remember we learned this in the cerebrum, when there's clusters of neurons within the white matter, we call those nuclei. Well, it's very similar in the hypothalamus. So here you can see two different clusters of neurons. Here are their cell bodies. They're just showing you one, but it's more. And so they're called the paraventricular nucleus and the suboptic nucleus. And so these neurons, again, they originate up here in the hypothalamus, but their axons extend through the infundibulum and go into the posterior pituitary. So the posterior pituitary, I had already just mentioned, is made out of nerve tissue. Well, that nerve tissue, it's the axon and the synaptic terminals of the cells that originate in the hypothalamus. Okay, so the hypothalamus, these nuclei, the cell bodies in the hypothalamus, they actually make the hormone. And that's what these little dots indicate, the purple and pink dots. These are the hormones that are being made up in the cell bodies in the hypothalamus, being conducted down the axons, and they get stored in the synaptic terminals at the ends of those axons. Okay. So it's the hypothalamus that makes the hormones. The posterior pituitary doesn't make its own hormones. Okay? When the hypothalamus is ready to release the hormones, it releases it through the little capillary bed that's associated with the posterior pituitary, and it releases those hormones into regular regular circulation. Okay, so now you can see at the bottom of the slide here is that the hypothalamus makes two types of hormones, okay? Vasopressin and oxytocin. So vasopressin we actually talked about before because its other name is ADH, antidiuretic hormone. So this is the hormone that we mentioned in the kidney when we need to reabsorb more water if the body is still too dehydrated. So this is homeostatically controlled, right? The levels of water, we said that was a homeostatically controlled variable. So again, the hypothalamus is the integrator. So when the hypothalamus receives a signal from the sensory receptors that water levels are low, it will then make ADH and then release it via the posterior pituitary gland. And so its target cells are the collecting ducts. And remember that at the collecting ducts, then once the ADH binds, that signals the cells of the collecting duct to make more of those aquaporins, those water pores, so that it becomes more porous. And so more water leaves the filtrate from the nephron and goes into the bloodstream. And therefore we reabsorb water. Okay. The other hormone, and we've already spoken about this when we talked about homeostatically controlled systems, was oxytocin, but this one actually we used as a description for positive feedback. So remember that the uterine contraction, the hypothalamus will receive a signal that the uterus is being stretched, and so it will release oxytocin, and oxytocin, the target cells are the muscle cells of the uterus, and it will cause it to contract, and that contraction again will be a signal to the hypothalamus to release more oxytocin, and so on and so forth. It also functions after birth to help with during breastfeeding, to help eject the milk during breastfeeding. Okay, so that's oxytocin. So again, the relationship between the hypothalamus and the posterior pituitary, it's all neural tissue. So the axons travel through the infundibulum. The cells of the hypothalamus make and secrete ADH or vasopressin, this method, the posterior pituitary gland, into circulation. Okay, so the posterior pituitary gland is just kind of the vehicle for these hormones to be released. It doesn't make its own hormones. Okay, and that's going to be different in the anterior pituitary. So that's why we make this distinction. Because in the anterior pituitary gland, it can actually make 6 hormones. Okay, 5 of them are what we call tropic hormones. I think I mentioned in the previous part, part 1 of this lecture, tropic hormones means nourishing. So these hormones will then nourish and stimulate another endocrine gland to release its hormone. Okay. So the endocrine gland, the target gland, it doesn't know to release the hormone unless it gets the stimulation from the anterior pituitary. Okay. Well, the anterior pituitary also gets its orders from the hypothalamus as well. So the anterior pituitary will not release these hormones unless it gets a signal from the hypothalamus, and that signal is going to be a little bit different. So I need to explain that to you. So we're actually going to go over the 5 tropic hormones, and I'll just kind of mention the 6th one here. Well, I'll do it now. The 6th one is called prolactin, and the anterior pituitary makes prolactin, and the target cells are the mammary glands in the breasts. And so prolactin is what encourages breast growth and secretion, milk secretion, during pregnancy and then just after pregnancy. Oxytocin is kind of the signal, okay, now it's time to let the milk out. Okay, so that one, it's not stimulating an endocrine gland. That's why it's not a tropic hormone. The other hormone, luteinizing hormone, adrenocorticotropin hormone, and thyroid stimulating hormone, each of these stimulates a different gland, which will then in turn release its hormone. So we're going to go through that. We're going to go step by step through the different glands. You're going to see feedback loops. But before we do that, we do need to look at the connection between the anterior pituitary gland and the hypothalamus. Okay, because again, it's a little bit different. Before I show you this slide, let me go here. So again, we're up here in the hypothalamus. You see neurons associated with it. And these neurons are short compared to the ones between the hypothalamus and the posterior pituitary. Remember, those neurons were long because the axons traveled through the infundibulum. Well, these are short. They stop just short of the infundibulum. But within the infundibulum on the front side is a portal system, a little capillary system. And it's a system that only travels between the hypothalamus and the anterior pituitary. Okay, it doesn't go into general circulation. So the anterior pituitary I mentioned can make those 6 hormones, and it does so down here in the epithelial tissue. There's different types of epithelial cells, and each cluster will make one of those 6 hormones. But how does it know how to do that? Well, it knows because the hypothalamus can make a hormone that will travel just through this portal system in the infundibulum called the hypothalamic hypophyseal portal system, right? It'll travel just through there and stimulate those cells. So the hormones that the hypothalamus makes, its target cells are in the anterior pituitary. Okay? And so each of the types of tropic hormones have their own signaling hormone from the hypothalamus. And we tend to call those releasing hormones. And that's what you see in this, this table. It's a nice table. It's in your textbook as well, 18-4. Okay. And so, so again, if we anterior pituitary to control the thyroid gland, let me go back here first. Okay, it does so through the thyroid stimulating hormone, right? So thyroid stimulating hormone stimulates the thyroid gland, okay? But the anterior pituitary won't release TSH or thyroid stimulating hormone unless it gets the hormone from the hypothalamus called thyrotropin releasing hormone. And you know what, if you end up calling it thyroid releasing hormone, that's fine. Okay, everyone will know what you're talking about. But technically it's thyrotropin releasing hormone, TRH. So TRH gets released from the hypothalamus. It travels through that portal system. It's a hormone. And its target cells are the cells of the anterior pituitary that make TSH. So it stimulates the anterior pituitary to release TSH. So that's thyroid stimulating hormone. Its target cells are the thyroid gland. Okay, and we'll get back to that in just a minute. You can see that the anterior pituitary also signals the adrenal cortex to release a hormone. Okay, and so to do that, it first gets a signal from the hypothalamus, which releases CRH, corticotropin releasing hormone. So that travels through the portal system, through the infundibulum, targets the epithelial cells in the anterior pituitary that make ACTH, adrenocorticotropic hormone. Okay, right here. So that gets in the general bloodstream and stimulates the target cells in the adrenal cortex. And then again, we'll continue that in a minute. And then we're going to put everything together at the end. Okay. Growth hormone is also a hormone that targets many cells, right? And so some of these will be directly stimulated. Others make other hormones, which again, we'll talk about in a minute. Okay. To stimulate that, there is growth hormone releasing hormone, GHRH. That's the hormone from the hypothalamus, targets the anterior pituitary to release growth hormone. Okay. So growth hormone gets released out of the anterior pituitary and targets several different organs. Again, we'll talk about that later. In order to stimulate the ovaries in the females and testes in the males, those 2 organs make hormones that control sexual reproduction, right? And so the anterior pituitary has 2 hormones to do that, follicle stimulating hormone and luteinizing hormone. These, by the way, are named for their role in the female body. Okay. So in order for the anterior pituitary to get the signal to release follicle stimulating hormone and luteinizing hormone, it gets a signal from the hypothalamus to release gonadotropin releasing hormone. Hypothalamus releases gonadotropin releasing hormone that targets the anterior pituitary, and then the anterior pituitary releases FSH and LH. And those target the ovaries in females and the testes in men. And I'm not going to get too in depth in that for this lecture, because when we're going to go over the control of the reproductive system. Okay, so those are two hormones we won't really talk about in this lecture. All righty, and again, and that's it. All right, so the thing to remember here is the connection, again, between the hypothalamus and the posterior pituitary and what hormones that releases, and that those hormones are made in the hypothalamus. And then the connection between the hypothalamus and the through the portal system. So the hypothalamus releases its tropic hormones called releasing hormones. You will need to know the specific one for each pathway. Okay. And so then what hormone, the releasing hormone, stimulates out of the anterior pituitary, and then we're going to continue the pathway of the stimulation to those endocrine glands and what their target organs are. All right, so first let's do the thyroid gland. Okay. If you remember from anatomy, the thyroid gland sits right underneath your Adam's apple. There's a little soft tissue there, a little butterfly-shaped tissue that just kind of wraps around the lateral and the front side of your trachea, right underneath the Adam's apple. And so it's within here. So here's a microscopic view, and probably in anatomy, you had to identify the thyroid gland by looking at the tissues under the microscope. So you might recall that the main cells, the epithelial cells in the thyroid gland, are the follicular cells, and they form the circular structure. So all these little tiny cells in there are the follicular cells, and they encapsulate, they have this fluid on the inside called colloid. Okay, and so it's the follicular cells that make the thyroid hormones, and then they secrete it into the colloid for storage. And then once it gets its signal from the anterior pituitary, this will be released out of the colloid and go into the bloodstream to travel around the blood to its target cells. Okay. So the two types of hormones that the follicular cells make are T3 and T4. That's the easy way to say it. T4 is sometimes also called thyroxine. You can see the long names for T3, T4. It's okay to just call them T3, T4. Okay. The 3 and the 4 indicate the number of iodine ions that are attached to the molecule. So here you can see the whole molecule here. You need tyrosine to make the amino acid tyrosine to make T3 and T4. But also it's very important to have iodine. Without iodine, the gland doesn't work. The hormone won't work. So if 4 iodine attached to the molecule, we call it T4, and that's the inactive form of the hormone. Okay, and we might secrete more of that into the blood to get the blood ready to go with this hormone, to have it up in a higher level. And then the cells, its target cells, will have to convert it by clipping off one of these iodine. The hormone that's ready to go is T3, so it only has 3 iodine on it. So this is an active form of the hormone. Yeah, that's an active form of the hormone. And I think I have, yeah, I do. So again, thyroid hormones, T3 and T4, they remain in the colloid until they are split off and get secreted into the bloodstream. And usually there's enough stored in the colloid to supply the body's needs for several months, right? And so how does it get secreted? So those follicular cells actually phagocytize the colloid. They take it in, and that process then frees the T3 and the T4 to diffuse across the plasma membrane and get it into the general bloodstream. Okay, and then we'll go from there in just a minute of where it goes, where it's in the bloodstream. I did want to mention that the other cellular cells, these are called C cells. All of this stuff packed in there. C cells make calcitonin. And we're not going to get into it specifically in this lecture, but calcitonin helps to regulate calcium levels along with the parathyroid hormone. And parathyroids are on the back side of the thyroid gland. Okay, we're going to stick though right now with thyroid, the thyroid hormones T3 and T4. Okay, so basically the target cells of the thyroid hormone are most of the cells in your body. Okay, most of the cells in the body. So here's a list of what they do. They maintain your basal metabolic rate. So again, that's your metabolic rate when you're at rest. That's the metabolic rate, the rate needed for metabolism to just kind of keep your body alive at rest. Okay, so we're always kind of secreting this in order to just maintain this basal metabolic rate. And then we can secrete more when we need to increase the rate of metabolism. Okay. And when we do this, it can influence the synthesis and degradation of carbohydrates, fats, and proteins, right? It increases the target cell responsiveness to catecholamines. And remember, that's your norepinephrine and epinephrine. Okay, and so I mentioned in the previous part 1 lecture that thyroid hormone just helps to kind of prime the target cells to be more responsive to epinephrine and norepinephrine. So therefore, the next one is true. It increases heart rate and the force of contraction. Okay, it's also essential for normal growth. It also helps the body, works with growth hormone as well. Okay, and it plays a crucial role in the normal development of the nervous system from the fetal stages of development when you're in the womb. Okay, so this is the big part, what you have to know, the regulation of thyroid hormone secretion. Okay, ignore these two at the top. I'm going to push them out of view. Okay, what I want you to see is, so you've got to know this flow. You have to be able to trace this pathway. Okay, so it starts with the hypothalamus. Okay, and the cells there will make and release thyroid releasing hormone or thyrotropic releasing hormone, TRH. The target cells for TRH are the anterior pituitary. That stimulates the anterior pituitary to release thyroid stimulating hormone. The target cells for TSH is the thyroid gland. That stimulates the thyroid gland to release thyroid hormones, T3 and T4. So the target cells for the thyroid hormone, T3 and T4, are most of the cells in the body. And again, it mainly increases metabolic rate. And when you increase your metabolic rate, remember that one of the things we're doing is making more ATP. So that increases heat production as well. Okay. Now, here's the control. Because you don't want this to go out of control. You don't want the anterior pituitary to just keep secreting thyroid hormone, right? So the one way that we control this is not to, we don't really sense if metabolic rate has gone up enough or heat production. What we sense is the amount of hormone in our bloodstream. So as thyroid hormones start coursing around our bloodstream, it can actually signal the anterior pituitary gland. It senses the level of T3, T4. And when those levels get high enough, then that's a negative feedback on the anterior pituitary, and it stops the release of thyroid stimulating hormone, which then the thyroid gland ramps down its production and release of T3, T4. And so we just kind of go back, hopefully everything had been homeostatically regulated. If this gets too low, we can increase it again. Okay, what I pulled out of view here were that other things can also act on the hypothalamus and its control over the anterior pituitary. So in adults, stress can actually have a negative effect on the hypothalamus. So when you're very stressed, you can inhibit the hypothalamus from releasing TRH, which inhibits the anterior pituitary from releasing TSH, which inhibits the thyroid gland from releasing T3, T4. So the effect is you'll have a lower metabolic rate. And that's why a lot of times when you feel stressed, you're tired, right? It's hard to get going. Okay, so exercise and things can help relieve the stress and take this negative effect off, and you feel better. Okay, it's hard to get going though. This one, cold in infants. Now, infants don't have the ability to shiver when they're cold, like we shiver, right? Remember those little micro contractions of our muscles, cells, they end up producing more ATP. And then, right? And so then when we produce more ATP, we release some of it as heat. So infants don't have the ability to shiver. So cold, when an infant is cold, that can actually stimulate the hypothalamus, which targets to release TH, which targets the thyroid gland, which releases thyroid hormones and increases their metabolic rate and therefore their heat production. Okay. And so when it increases their heat production, it warms their body. Okay, so I just wanted to mention those outside influences. Okay, and then here are some disorders with the thyroid gland. So we have two types of things, hypothyroidism or hyperthyroidism, right? Hypo means less of, right? Hyper means more of. So when hypothyroidism means that the thyroid is understimulated. Okay, and so we usually say we have primary causes and secondary causes. A primary cause for an endocrine gland disorder is the gland itself, right? So we're talking, if we're saying hypothyroidism, we're talking about the hypothyroid, we're talking about the thyroid gland itself. So a primary failure would be the thyroid gland. A secondary failure, secondary deficiency could be something going on with the pituitary gland or the hypothalamus. So if the hypothalamus is not releasing enough TRH or the pituitary gland is not releasing enough TSH, right? Primary hyposecretion, then you have too little hormone is secreted. It's usually due to an abnormality within the gland. So that could be genetic, so there's an absence of enzymes that cause the synthesis of the hormone. It could be dietary, and that's also very common in mostly women don't get enough iodine in their diet as they get older, and so they tend to suffer from hypothyroidism, right? There can be autoimmune disease or other disease processes such as cancer, right? Sometimes if you have your thyroid gland removed maybe because of cancer or something, then of course you would have hypothyroidism. You would have to take medications to put the hormone into your bloodstream, right? If you have a cause that's called idiopathic, that usually means that the cause is unknown. Okay, the cause is unknown. All right. Again, the secondary hyposecretion is your gland is normal, the thyroid gland is normal, but there's too little hormone is secreted due to deficiency of the tropic hormones. Right. So the symptoms are usually you have a reduced metabolic rate, and you can kind of maybe get on canvas, you can blow up the slide and you can see the symptoms there in the middle panel. But there's usually a reduced metabolic rate, and so you tend to be more cold. If your metabolism is low, then you're not burning calories as much, so you might have weight gain. Again, you're easily fatigued. You might have a slower or weakened pulse, slower reflexes, slower mental responsiveness. Sometimes the skin can be infiltrated with water retaining carbohydrate molecules, probably because your metabolism has been altered, and it gives a puffy appearance. And so one condition of hypothyroidism is cretinism. This is usually dwarfism. And remember, we said the thyroid hormone is important in development of the central nervous system. So there's usually a lowered intelligence associated with that because of reduced central nervous system development, right? So if it's cretinism, it's usually hypothyroidism from birth. Myxedema is often used for hypothyroidism in adults, right? And so usually it depends. If it's a decrease in iodine, then increasing your dietary iodine can actually reverse it. Replacement therapy for the hormone could actually also helps as well. Right? Hyperthyroidism. Graves' disease is the most common cause. This is an autoimmune disease. It's the target of the receptors in the thyroid cells. Okay, so there's a antibody called I got to read it on here. Thyroid stimulating immunoglobulins, TSI. And so the body, because of the autoimmune disease, it produces these TSIs. And it's a antagonist of the TSH receptors on the thyroid cells. So it blocks those thyroid cells. And it actually, so it blocks it, not allowing TSH to bind, but when it binds, it actually stimulates the secretion and growth of the thyroid. So TSI has similar effects as TSH. However, let me go back here to this. So if this is TSI stimulating the thyroid gland, you're not going to get the same feedback loop. So it just kind of goes out of control, right? And so that's why it's hyperthyroidism. Okay, and it says here, characterized by exophthalmos. That's what, oh, I have that feedback there. I'll show you here. Here's exophthalmos. It's kind of the bulging of the eyes. Again, there's retention of fluids and things behind the eyes, and that kind of makes the eyes look like they're bulging out. Okay, here's the feedback loop. So the anterior pituitary is not producing TSH because this TSI is being produced. Again, that's just autoimmune disease. So the body is producing TSI. That's acting on the thyroid gland. Okay, and so with the anterior pituitary, it thinks, oh, I'm not supposed to be producing TSH. However, with all the TSI, it overstimulates the thyroid gland, and that's where you get this hyperthyroidism. Okay, so the treatment could be surgically removing a portion of the over-secreting thyroid, so that can kind of slow down how much it secretes. If you administer radioactive iodine, that can actually inhibit part of the thyroid gland as well. There's anti-thyroid drugs. I meant to take this off. I need to find my video. My cat was hyperthyroid, and one of the symptoms of being hyperthyroid is irritability. And so my cat was very irritable, and he would walk around with this horrible meow. So I had a video of him. If I find it, I'll link it back up here. But right now this link doesn't work. Right? He was irritable all the time. Hey, but I kept him going. I gave him drugs that inhibited the thyroid gland, so it slowed it down. And I kept him going till he lived till 18. He was a good guy, good kitty. All righty, so that's the thyroid gland. Oh, the other, if you have hypothyroid, right? Let me go back to this here. So with hypothyroidism, you're not releasing of the T3 and T4. Okay, so if you're not getting enough of the T3 and T4, that means you don't have your negative feedback loop. And so the anterior pituitary doesn't know that you have enough T3, T4. So, and you don't, right? That's why you don't have the negative feedback. So it starts to release more thyroid stimulating hormone. And even the hypothalamus can sense it and start releasing more TRH. So what happens is releasing more of the tropic hormones is like you're screaming at the thyroid gland, come on, produce your hormones. And the thyroid gland is going, but I can't. I'm hypothyroid. I don't have the iodine, or something else is going on. So remember, though, that these tropic hormones are nourishing hormones, and they cause the organ to grow. So when the organ is getting, the thyroid is getting overstimulated, it grows uncontrollably, and that's what a goiter is. The thyroid gland is actually this big. Okay, and most people in this country, we have access to doctors. So most women, we catch it. It might be a little bit swollen. So women who have hypothyroidism, it might be a little bit swollen, but mostly you can't tell. But then again, we can control it through drugs, and that'll shrink down. Okay, I'm going to end this video here. Again, I'm trying to keep these somewhat short. That was about 35 minutes. And so the next part, we will talk about the adrenal gland. All right, thanks everybody.